AI may be generating hundreds of low-quality, low-effort biomedical articles. As a general rule, a large open-source dataset of public health records should be a good thing. Examples include the UK Biobank or the Global Burden of Disease. But it appears that these types of massive datasets are being exploited by generative AI to create low-quality, easy-to-produce papers. One meta-review from 2025 examined research papers that used the National Health and Nutrition Examination Survey, NHANES, a survey of health and nutritional status of adults and children in the United States. The data is sourced from tens of thousands of people over a period of decades and includes over 700 variables such as depression, diabetes, blood pressure, sleep health, and so on. The authors of the review found 341 articles published from 2014 to 2024 that employed single-factor analysis that showed statistically significant correlation between one predictor and one adverse health outcome. Of course, it is not usually possible to say for certain whether AI was used to generate a paper, but there were strong suggestions. For one, after generative AI like ChatGPT became mainstream in 2022, the number of these single-factor analyses increased more than 20-fold compared to the baseline from 2014 to 2021. Also, most articles after 2022 selectively extracted data from certain years and from certain cohorts, which seemed to be cherry-picking in search of statistical significance. This is something that an AI can be asked to find in a post-hoc manner by, for example, using prompts like find a statistically significant relationship between two factors that have not been published in the literature. In a particularly striking example, 28 different papers found 28 different causes of depression. One of these found that high blood pressure caused depression, although the p-value was very significant at 0.044, and that was for diastolic blood pressure, whereas systolic blood pressure had a quite high p-value of 0.09. The authors of the meta-analysis then applied a more advanced forced discovery rate FDR correction on all of the articles and found that less than half remained statistically significant. Crucially, 25 of the 28 papers were published in 2022 or later. The 3 papers published before 2022 all retained their statistical significance after the correction, suggesting the findings were robust. The collected p-value for diastolic blood pressure, it became incredibly high, 0.173. In this new era of generative AI, it may be difficult or even impossible to know whether a single paper was created by an algorithm with minimal human research effort added. Yet thankfully, as this meta-review showed, when too many people take the same easy route, it becomes possible to identify the AI patterns.